I've got Seth Berkley, a doctor who's focused on some of these health issues you're talking about with Gavi, and Nargis Shirazi, is that correct? Who is a playwright and can uphold sort of the celebrity end of this debate. Again, Dr. Seth Berkley from Gavi and Nargis Shirazi. So let's hear about the arts side of this public health debate that you're talking about, the importance of vaccines, and some of the technical medical issues at stake here. Nargis, I'd love to start with you. We were talking before we started rolling here about the importance artists can play in shaping this debate. Right here in the United States, we've had celebrities come out and say, don't vaccinate your children. And that's actually caused some real public health problems in some wealthy schools in Los Angeles. Lower vaccination rates now than you get in South Sudan. Resurgences of whooping cough, things you wouldn't expect. So tell me about how, as an artist, as someone who tells stories, you would advise other artists to either get into or stay out of that kind of a health debate.
It's a very good question. I think it's very important for us to realize that people tend to follow stars. So as artists, as people who are in the arts and entertainment field, we can get a very strong following. So it's about time that we used our arts and entertainment for change. So in this case, it would be very interesting. Sing a song about why we need to have vaccination, for example. Write a play about why it's important for communities to embrace vaccination in order for children to stay alive beyond the age of 5, for example. So it's very important for us to use that as a tool to bring about that change that we need to see when it comes.
And Doctor, how damaging has it been to have celebrity anti-vaccine activists in the game on this conversation?
It's huge because they don't understand the effects that they're having. We here don't see the diseases, so we assume they're no longer a problem. And then as coverage drops down, we get a critical mass, and then we have an explosive outbreak. And all of a sudden, children die or are permanently disabled as a result of that. So it's really important to make sure that good information flows and that we don't end up in a situation where wealthy people have coverage rates like that of South Sudan.
And what would you say to some of these anti-vaccine celebrities who are, in my experience, also telling other celebrities to either come out and say, don't vaccinate your kids, or at least hold back from talking in positive terms about vaccines?
Well, the first thing we should do is have them get the facts. But if they had an opportunity to go to places, I've been in refugee camps, I've seen the baby graves lined up, I worked in Uganda and have seen the effects of these diseases. If they understood how powerful these diseases are, that's why we used to have 20, 30, 40% of kids die before they were 5 years of age. We assume now all our kids are going to live because we have these fabulous vaccines to protect them. We have to continue to remind people of that.
Nargis, you also work with women's organizations. Women to Women is one of your groups. Tell me what you tell women who are considering whether to vaccinate their children.
Well, that's a very interesting question. We tend to tell people not to do something or to do something without necessarily painting the picture of the what if they did not do something. So when we talk to young women and even the older women, we always put across the message that if you do not vaccinate your child, you would be cutting your child's life by a specific percentage. For example, your child will not be able to be healthy, your child will not be able to go to school, receive a proper education, and at the same time you would also incur some costs, because when a child falls sick, at the end of the day you're going to spend some amount of money in a hospital. So we normally try to bring out the message in that way.
Right, what the actual human consequences are of not vaccinating.
Yes.
As many as 6 million kids every year die because of lack of access to some of these treatments. What is Gavi doing to try to reverse that trend?
So our goal is to work with the 73 poorest countries and help them build up their health systems like we did in the Ebola countries where we invested 50 million, but it wasn't strong enough. And we also get the vaccines out in these countries, the ones that are recommended by WHO. So we've immunized 440 million children so far and prevented 6 million deaths. In this next period, which is what we're talking about at this concert, we're hoping to immunize an additional 300 million children and prevent another 5 and 6 million deaths in the period 16 to 20 by raising an additional $7.5 billion.
And how important is the private sector in that? Gavi is focused a lot on private-public partnerships.
That's absolutely right. So, of course, we need vaccines, and those are made by private companies, and we work with them to try to shape the market, bring the price down, make sure there's supply security, and that new manufacturers come in from developing countries. But we also work with private companies on logistics, on better data, on systems to get finance out to countries, because at the end, it's about delivering the vaccines, and who delivers really well? The private sector. sector. So let's use their expertise to help us move.
And it's going to take a combination of that private sector resourcing and some of the passionate messaging that you're talking about to actually change the conversation about this. This is such an important set of issues. Thank you, Doctor. Thank you, Nargis. Appreciate it. We're going to be hearing from a lot of world leaders on this subject, on the contributions being made, and a lot of celebrities on this debate. Stay with us. Keep it right here. We have much more of the Global Citizen Festival coming up next.